Hi everyone, I'm Tracy with Nurse Disrupted in the virtual volunteer program, and we are here with you today to do the COVID-19 screenings at the shelter. I have a few updates to share for the start of the shift. The first is to please continue to maintain social distancing of at least 6 feet apart between yourself and everyone else. We understand that it's hard to do, but do your best to try to maintain that space. Next, all volunteers, clients, and staff are recommended to wear a cloth face covering. Please note that the cloth masks are not considered PPE. The medical volunteers who are helping screen guests for COVID-19 should wear personal protective equipment or PPE. The PPE includes disposable gloves, an N95 respirator mask, procedure mask, and face shield. I'll review the correct steps to put on and take off PPE in a couple minutes. After your shift, it's highly recommended to launder your clothing using the highest heat and wash setting. So washer, dryer at the highest settings possible. Next, let's cover screening. You cannot screen too much. You cannot screen too often. Someone may have screened negative yesterday and still screens in today. It doesn't matter if you think someone's gaming the system. We just have to stick to the guidance to be fearless in this screening. Now, as a reminder, the initial COVID-19 screening questions are, do you have fever or chills? Do you have a new or worsening cough? Have you been feeling short of breath or having trouble breathing? Have you been sneezing or do you have a runny nose? And last, have you lost your sense of taste or smell? If a guest answers yes to any from the list, please send them to the office on the right side of the check-in for additional screening. Once the guest is comfortable in the side office, you'll take their temperature. Ask the guest to remove any hat or head covering and wipe away any visible perspiration. The thermometers we have are touchless. So turn the thermometer on and make sure it's on the body setting. Take the temperature standing to the side of the guest. You don't want to be right in front of their face. So you want to point the thermometer at the center of the guest's forehead, about 2 inches away from the skin, and press the button until it beeps. Say the temperature reading out loud for the virtual volunteer to hear. Last, a couple reminders about putting on your PPE. So step 1, wash your hands or use hand sanitizer for at least 20 seconds. Next, put on your N95 mask. As an example, I have one here. You want to make sure that the top strap is in the back of your head and the lower strap is around the nape of your neck. You want to make sure that the top of the mask fits snugly over the bridge of your nose and apply pressure to the metal piece. And then you want to make sure to check the bottom of the mask to ensure that there's no gaps for air to pass by. You can check this by blowing a few times in the mask when you're wearing it to make sure you don't feel air passing through. The next step is you'll apply a procedure mask over the top of your N95 mask. So you want to find the top edge of the procedure mask. It has a metal piece in it. So this top edge goes over your nose. You can apply pressure around the metal piece over your nose and pull the bottom edge under your chin. Next, the CDC recommends that medical volunteers wear a face shield. To put on the face shield, you want the foam pad to sit in the middle of your forehead and the strap to go around the middle back of your head. And then last, you want to apply disposable gloves. So when it comes time to take off your PPE, here are just a few reminders. So you want to remove your disposable gloves. These are considered contaminated. So you want to touch the inside of one dirty glove with the other dirty glove and pull your hand out. Then you want to ball up the dirty glove in the other dirty glove and take a clean finger and go underneath the other dirty glove. And then peel it down inside out, keeping the contaminated sides together and secure, and then throw them away. Next, you want to remove the face shield by touching the strap in the back, pulling it up and away from your face, and then and set that to the side. Remove the procedure mask by using the ear loops. You do not want to touch the outside of the mask because it's considered contaminated. So only touching the loops, take it off your ears, remove, and dispose of. And then next would be removing the N95 mask. So again, you want to touch the straps in the back, bringing them up and around to the front. Do not touch the outside of the mask because it is considered contaminated. And then last, wash your hands again for at least 20 seconds using the soap warm soap and water, or the hand sanitizer. So in closing, for each encounter, please remove gloves, use hand sanitizer, and apply clean gloves for every guest. And then you should also remove gloves before leaving the screening office and apply gloves once you enter. So thank you so much. I just shared a lot of information. The virtual volunteer will be here with you for the shift to answer any questions, and have a wonderful shift. Thanks.